Hi everyone, I am Dr. Ramakrishna, consultant physician, Yashoda Hospital, Malakpet. Today I'll talk about changing lifestyle is the most effective treatment of hypertension. Hypertension as such has become more common these days, particularly in young adults. Lifestyle modifications, because of their working habits, daily needs have changed a lot and causing hypertension as well as other problems like cardiac problems, cholesterol problems, sleep deprivation disorders, and so on. Hypertension as such is high blood pressure measuring about more than 130 by 80 or 140 by 90, like pre-hypertension. What is unhealthy lifestyle disorders? What is unhealthy lifestyle habits? Irregular sleeping habits, more intake of salty items, sweets, sweeteners or processed food, sedentary lifestyle and stressed up life are said to be unhealthy life habits. And how to cope up all these things? First, let us take about diet. Diet plan should be depend on your working style and calorie usage. The amount of intake of food is almost equal or to the lesser extent of the calorie wastage you do regularly. It should be planned accordingly and they should be very simple to manage. You have to take more vegetables, more fruits of less salt intake and less sweets, and even animal origin food items also in a moderation you can take. And alcohol, more than 2 alcohol drinks per day is not advisable. And second thing is sleeping habits. Sleeping should be 7 hours, preferably in a stretch, should be good for health. And there is a myth that sleeping for more time in the weekends will solve the problem of rest of the 5 days. It is not correct. The daily sleeping should be preferably 7 hours in a stretch, will not cause any stressed up lifestyle. And the third one is stress. Stress will have so many health disorders, out of which hypertension, diabetes, obesity, cardiac problems are nowadays more common. Stress should be reduced in various ways by relaxing methods. And you can choose one of the methods like yoga, journaling, walking, and various other methods which can reduce, which you feel you are better with these techniques. And fourth one is physical activity. Out of physical activity, there should be minimum of 30 to 60 minutes of physical activity per day. It need not be brisk walk, running, jogging or cycling. Even if you have normal steps or put together 6,000 to 8,000 steps per day will do. And that is compulsory between 5 to 6 days per week is advisable. And these few methods, if you follow regularly in day-to-day basis, your hypertension may come to normal level, or you can have little bit reduce the dose of antihypertensives as well. Today I'll talk about salt and hypertension. The consumption of salt in normal Indian is more than 10 grams per day, which physiologically has to be taken only 2 grams per day. Even as per WHO criteria, it should not cross more than 5 grams. And what is the relation between salt and hypertension? More salt intake will cause more extracellular fluid and thus cardiac output increases, which causes a cascade of physiological events which will increase blood pressure. And another thing is, the more salt intake, the excretion of salt will be, the fluid loss from the kidney will be more and less toxics will be excreted. And about Indian diet and salt. Most of the Indians will have a lot of salt in their food items, which contains a lot of pickles, preserved foods, namkeen, chaats and so on. And that salt itself will have more than 10 grams per day, though it have other benefits like containing vitamins, vitamin C and other things, the amount of salt which is causing more trouble to them. As such, Indians previously used to have no salt food intake with a lot of vegetables and fruits. After that, because of seasoned food and preservatives which developed in India, they have started adding pink salt, rock salt and black salt, which are native salts, which used to contain a lot of other minerals as well. And once processed salt have come, refined salt have come, it has left with only iodine. Except iodine benefit, nothing used to be there except sodium and chloride, which started creating troubles to hypertension and other health disorders. Does really low salt intake will benefit the hypertension? We have two studies. One is a DASH study, sodium study, which they have used a control group and another DASH diet group, which they have used low salt intake with a lot of vegetables, fruits and very less amount of salt, and another with a normal amount of salt intake. And in both the groups, they could able to make out in the DASH study group significant reduction even in the normotension as well as hypertension group blood pressure, significant reduction in blood pressure. And one more study, he and McGregor study, where they could able to make out with low salt intake, there is a drop of 7 systolic in hypertension group with 3 diastolic drop of blood pressure with only control of salt intake. In nutshell, what has to be done? Shall we stop all delicacies of Indian spices? Not necessary. It should be cut down to moderation, and apart from that, other alteration of food items. Cut down all other items which contains most of the salted foods, salted nuts, seeds, beans, lentils and pickles which contains lot of salt. In this way you can adjust with moderation we can adjust the salt intake. This is the only way to cut down the salts and as well as to continue the delicacies of Indian food items. Considering all these health benefits in normotensives to prevent getting hypertension and in hypertension patients to reduce the level of hypertension with medication as well, reducing the salt intake is a good option and better to follow a low salt intake diet. The effort to reduce the salt intake is worthwhile. Do follow with strict salt reduction. Thank you.